Okay, everyone, welcome and thank you for joining us this evening for what will be the first of a series of ITP Support Association special patient virtual meetings. This meeting is being recorded. This series of meetings will major on the psychological aspects of what affects a patient with ITP, and hopefully provide you with some tools and ideas as you go along over all three of the meetings, with some tools and ideas that will help you manage your condition. Joining me today is Professor Adrian Newland.
Hi.
And Rhonda Anderson from the board. And our special speaker today is Dr. Andrew Morgan. And for those of you who were at our Liverpool meeting last year, you will remember Andrew did an excellent presentation at that in-person event, and likewise at our patient conference that was held in Manchester at the Bridgewater Hall back in May. Andrew did a really good presentation there, which was really well received. And I believe the survey we had, it was voted in the top 2 of the presentations that day. So we're quite pleased. So Andrew is a clinical psychologist from Liverpool University Hospital, and he will be talking today, basically doing a presentation. There will be the opportunity at various points during this presentation to get involved, answer questions, but we will be looking, as well as this is a series of up to 3 meetings. The next one will be in August, and then the final one will be in September. We will aim that the later meetings will major on the opportunity for even more questions. So, Andrew, over to you, sir.
Thank you very much for a lovely introduction, as usual, Mervyn. Like Mervyn said, I'm a clinical psychologist. I work in haematology department at Liverpool Royal. And when Mervyn came to me with this great idea, he said, as he often does, that when he speaks to people, they talk about how useful they found psychology, or how much they'd like to try it, and how much they value any sort of input. And as he said, whenever I've done these sorts of things at the ITP days, they've always been well received. So he had the bright idea of doing a series of sessions. And I was thinking to myself when he brought this up, okay, what's a normal psychological group look like? Maybe you've got 4 or 6 or 8 people, and you take turns talking and you get to know each other, build relationships. And I said to him, how many people are we expecting, Mervyn? And he said, 85 people have signed up. And I thought, okay, stick the traditional method in the bin. We're going to have to do something a little bit different. And so what I've decided to do is to, over the 3 sessions, to give people a taste of what therapy would be like. So we're going to cover the same sorts of things I would cover in a therapy engagement with people, unlike my normal ITP presentations that are more just me talking. And so I'm hoping that there might be some useful stuff in here for people. Hearing other people's experiences might be useful. Maybe it will make people think, do you know what? Psychology would be something that would be useful for me to pursue. And also in the final session, we'll maybe talk about some ideas for how to take this stuff forward outside of therapy, because, it's certainly true that psychological well-being is not something that we need therapy for. There's many different ways to improve our well-being, and therapy is just one small part of that. The therapy I'm going to be talking about is acceptance and commitment therapy, or that's the model I draw on. That's my favorite one. And that's the one that focuses on living well, helping people have a meaningful life no matter what challenges they're facing. What I would say about the format is that it is a brand new thing. We're trying it out. There'll be opportunities to give feedback, and we'd really value that, because if we ever run this again, we're totally open to any tweaks, anything that would be good to be added or taken away or changed in terms of the format. Today's session is this intro part, and then we're going to be talking about ways to be present in our everyday lives and the benefits of that. The second one is going to be about ways to maximize meaning in our lives, to understand what we care about and how to achieve it. And then the third one is likely to be more of a Q&A if people bring questions, and if not, then I can just talk because I get a lot of practice of that as well. So in terms of the disclaimer, what I wanted to say here, as I always say at these sorts of things, is that I might know a bit about psychology, but you're the experts in your own lives. You're the experts in what you care about, the challenges you face. You're the experts in living with ITP, and I'm certainly not here to tell anyone what they should do or how they should think. This is just going to be a series of ideas that other clients of mine have told me have been helpful, or that I've learned from reading the research or from my own experience. Group principles, this is being recorded, so it is not a confidential space. So only talk about things you feel comfortable talking about. If anything difficult comes up for you and you're feeling emotional after the session, I would suggest you talk to someone that you trust, or talk to your clinical team, or even if it's serious enough, speak to your GP, or if you or someone else is ever in a situation where you're worried about keeping yourself or someone you care about safe, what we say is to phone 111 just in cases of emergency. Feel free to turn your camera off if you like. I know a lot of people prefer that. I sometimes do. If you ever want to leave during the session, then feel free to. I promise I won't be offended. There's no need for anyone to feel pressured to talk. There are spaces in this where I'll be asking people to reflect. You don't have to. Again, I know some people don't want to do that. That's fine. Just actively listening is a valuable contribution. If you do have anything to say, just butt in and talk over me, because there's so many people that I can't see the hands being put up in such a big group. So just go for it, and we'll just have to talk over each other sometimes. So the first thing I wanted to start with, a bit of a downer, but I think it's really important to get it out on the table to begin with, is that for me, the number one principle of psychology is that life is really hard. The reason that's important is because it can help us to have more reasonable expectations of ourselves. There's a message that people get from the medical establishment, from the wider culture, even from some psychologists, that if you're feeling stressed, if you're suffering, if you're angry, if you're sad, then that means you've got a psychological problem. But more often than not, I don't think that is a helpful way of thinking about it. I think those emotional responses are usually normal, natural, and appropriate. When you're in a difficult situation, when something stressful has happened, we're supposed to feel stressed, and that's not a problem. It's also not a real, or shouldn't be thought of, in my opinion, as a psychological problem, because there's no direct solution for that. You can't just choose to turn off how you're feeling. You can't just turn your frown upside down and think positively, and suddenly the thing that was a problem no longer is. I think that we'll talk in a moment about what psychology and therapy is about changing, if it's not directly about changing how we feel. But firstly, I wanted to ask people, what are some of the things in your life that cause you stress or suffering? And this is a good point for me to say that you might bring stuff that's about ITP, but it could be other stuff too. I'm a big believer, I say this every time, that the things that work in psychology and in therapy, and the way I work with my clients, is we don't always focus on someone's physical health condition, because the things that are helpful for someone with ITP are the same, broadly speaking, as are helpful for people with sickle cell, or they're going through a bereavement or work stress or whatever. So whatever it is you want to bring in answer to that question, what are some of the things that cause you stress or suffering? Has anyone got any ideas for us?
Yes, I have. One of them is uncertainty.
Mm.
And I think that this is something very much to do with ITP, because there's the uncertainty of the platelet level and what effect it's going to have.
That's a brilliant one. I would say if we were playing, was it Family Fortunes? you might have just picked the top answer there, Rhonda. That is one of the most difficult things for humans to deal with psychologically in general, I believe, and definitely with ITP too. Anyone else got anything?
I'd add getting stressed about stress itself. You know,
Yeah.
when you're stressed at work and you're thinking, I don't want to get too stressed, that might have a negative consequence for my autoimmune condition, and thinking, oh, how can I balance this? And then, you know, paradoxically, that becomes its own pressure.
Perfect example. I was just talking with another psychologist a few hours ago, and we were laughing about the medical advice that says just don't get stressed about your condition, and it might not be a problem. He thought that's the worst thing you could ever say to someone, because then they're going to be monitoring, noticing if there's any stress around, and they're going to find it, and it's going to become a vicious cycle. So I totally agree with you there, Stephen. Anyone else?
Well, if I could come in again, sorry, I don't want to hog this, but I think also it's people understanding how you're feeling, people like your family and also friends and so on. Sometimes you don't want to tell people because you're worried about how that will impact on how they see you if you've got worries and things. And also, you just don't want to seem like a sick person or someone who's got something wrong. You want to be sort of in control and in charge. And that feeling is really bad when you know, when there's something wrong and you don't feel in control. And I think you realize that it's having that effect on your family as well.
Yeah, that resonates with me very much based on the conversations I have with my clients, and I like the way that where you took it at the end, Rhonda. You know, the well-being of the people we care about, a massive source of stress for many of us because we care about them so much, right? And please hog away, anyone. You know, the more ideas, the better.
Hello? Yeah. Well, when I was like 20, my fiance said, Patricia, you aren't happy unless you worry. Now, all through my life, and even just recently, someone said, he said, I'm worried about you because all you do is worry. I've worried about everything all my life. I don't know what to do about it.
Well, Patricia, you couldn't have better placed that contribution, because that's one of the main things we're talking about today is worry. So again, it totally fits with my understanding of how this stuff works and the things I hear every day. The final one before we move on to the next little bit.
The stress of keeping to a regime that you've decided that's going to help make you better.
Perfect. So loads of really good ideas there. And again, things that we can see, things like uncertainty, stress, people understanding how we're feeling, how people see us, a lack of control, worry in itself, the stress of keeping to a regime that you think is going to make you better. In this context, we're talking a lot of the time about ITP, but it doesn't take a lot of imagination for us to see how these are general challenges in life too. You know, uncertainty is a perfect example, right? So my observation is, as I said before, lots of these things, if not all of them, or most of them, let's say, they're not things we can directly control. You can't just eliminate uncertainty from the future. You can't just choose not to feel stressed. You can indirectly influence some of these things, you know, by talking to people or looking after yourself or whatever, but they're not things you can just flip on and off like a light switch. So when I said before that the focus of psychology, in my opinion, isn't or shouldn't be about getting rid of suffering directly, of saying, you feel sad, we've got to make you happy. It's because what we are better off focusing on is how we respond to these stressful situations in our lives. How do we cope with them? Because that is something that we do have some degree of control over. So when we're feeling stressed in our minds and in our bodies, what are some of the things that we do that we find either helpful or unhelpful? Has anyone got any ideas about that from their own experience, or maybe, you know, loved ones or friends or what have you?
Get super busy and clean the house.
Yeah. Yes, classic. Classic. People tell me I potter around. The house is clean. I'm just moving stuff back and forth.
Lots of masking.
Can you say a bit more about that, Bonnie?
Yeah, so giving the impression that everything's fine, and you just want to look like everyone else and not have weird eating stuff and weird hospital appointments all the time and high anxiety. So you sort of try to blend, but blending is really stressful in itself. And then you have the kind of challenge of then managing the outcome of masking, which is high stress.
Yeah. So fair to say maybe that we might put that in the category of less helpful responses.
Absolutely. Yeah.
Any other ones?
Exercise as long as you don't think it kills platelets.
Yeah. Yes, I often, when I'm preparing those ITP day things and I'm going through the material, and you think, God, yeah, one of the most challenging things about the condition, at least as my clients tell me, is that it makes some of the things that would be helpful for dealing with stress harder to use as coping responses. Things like exercise or social engagement or work, you know, because of things like fatigue as well as anxiety or what have you.
It's very fashionable now to do what they call forest bathing, which is going out into nature. So go for a relaxing walk, maybe with a friend, maybe with your dog if you've got one. I don't. But you know, also the social interaction, the call a friend and discussing it with them if they're understanding enough to give you the time, and doing things that you enjoy, even if it's only something that takes 5 minutes or 10 minutes. I think, you know, when people seem to think they've got to do something, they seem to think they've got to do it all day. But sometimes you can just get a respite time. So for 10 minutes, you might listen to some nice music or read a book or do something that you really like doing. And I think that's very good to sort of punctuate your day or your time with these small respite moments.
Yeah, that makes very good sense to me. And you know, you kind of covered a good chunk of different things there on that people find helpful when they're feeling stressed. Things like reading, socializing, things like maybe creative activities or practicing a skill, or you mentioned nature before. Yeah, all these sorts of things can be very helpful for some people. Everyone's a bit different, aren't they, and what they care about, and that's what the next session is about, is raising our awareness of what are the things that float our boat. But these are definitely some classics.
Che tra poco arrivo.
Pardon? What did you say, Bibiana? Sorry, I didn't catch that.
Oh, sorry. No, I was responding to my friend. I do have some questions because I've been diagnosed in February 2020 now, 2025. And yes, I went through times where I was really, really tired. That was when I was sent home after 2 months of being in hospital with no results whatsoever. I was on prednisolone, and I felt like on top of the world in terms of no pain. Then my prednisolone was kind of tapered down, and now I'm on other medications like romiplastin once a week and immunosuppressants as well. But what I noticed is that before now my platelets actually they went up, they jumped. I'm on 130. I was like for a very long time on 2, 3, 4, 5. And yes, even when they were growing, I got that periods where I was really tired, all of a sudden just kind of crushed. I couldn't do anything. But now I don't get that feeling anymore, or not as often. And but I've got the pain on my legs. It's what makes me more kind of upset. I'm thinking like I'm not working at the moment. I actually took a redundancy payment, so ideally I could not work for several months, if not maybe a year or a year and a half. But I've got so many things that I want to do in my head, but somehow I can't really manage to do it. And I feel like every day I'm losing time, important pressure, because it could be one moment maybe I'm tired, the other moment what's the point, the other moment oh my pain, the other moment people wanted to see me. Also not working somehow I get more stressed out as well, because there's so many activities because I'm trying to get engaged so that I can actually go out and move, so that I don't cry on my pain. But I feel like a day like today, I feel like, what's the point of doing all of these? Because I've got the feelings really that some other autoimmune disease is gonna show up, like lupus and that is what worries the most. And therefore I'm thinking like, what's the point of trying to be always not upbeat, but try to find things to stay valid. I'm not sure what's the right word, but to stay current, to not lose, let's say, my professional skills or my ability to one day go back to work normal hours, if that could ever be possible. Because I know that I get tired after a little while, and I'm unable to concentrate as well.
Okay. Well, let me touch on that briefly, and maybe what we talk about in the next few slides will be relevant too. But I think one of the biggest misapprehensions or traps, again, it's not just the clients have it, but some psychologists too, and definitely our medical colleagues, is that in order to do something that matters to us, we've got to feel a certain way. It's the idea of motivation, right? You've got to feel like you want to do it to do it. And I think that what psychology tells us, and what my experience tells me, my client's experience, is the exact opposite is true. That being active, and I don't just mean like physically active, but mentally active and engaged, having or working towards our goals, whatever they may be, is something that comes with practice. It's something that we need to develop over time. And what happens when people have been ill or unemployed or whatever reason they've become more inactive is that they get out of practice. So rather than trying to be in the mood to do a thing, the other way around, the cart goes before the horse, that we want to do the thing whether we feel like doing it. And then what happens is we start to get back into the habit of doing things, and then we get the good feeling, the motivation, the rewards. So what I say to all my clients is set yourself a challenge, say once a day, of doing something that's important to you, whether you feel like it or not, and just test out what happens when you do that. So when you get that thought of, do you know what, I don't feel like doing this, do it anyway. And you might not enjoy reading those 10 pages of your book or what have you, but what happens for most people is that the next day it's a little bit easier, and then a little bit easier. I would say as well, the best types of progress in psychology, Bibiana, are slow and steady ones. 10 minutes a day adds up really fast. And you said something interesting at the start. You said, there's all these different things in my head. I think sometimes that bigger picture can get overwhelming. There's a saying, how do you eat an elephant? And the answer is one bite at a time, right? You've got a big elephant in your head, and sometimes you might look at that and think, how the heck am I going to fit this in my mouth? You don't have to. Just pick apart, start chewing. And what you may find is that over the days and weeks and months, you start to get back into that habit. And your mood, your feelings will come along with that then, but not normally before. People wait to feel a certain way. And what happens is because they're not doing things, their mood actually starts to go down a little bit. That can be a bit of a vicious cycle. I'll talk in a minute about some ideas that might be helpful. I think so. We've had a brilliant list of stuff that is helpful or unhelpful in response to stress. When we spoke before about things that cause us stress or suffering, you can fit a fair few of these under this category of overthinking. And Bibiana, I think, just spoke to that too. Worries about uncertainty in the future, stress about stress about people understanding how we're feeling, how they see us, a lack of control, worry itself. These are all understandable under the umbrella of overthinking. And I work on this with all of my clients, and I would say 9 out of 10 of them, this is one of the biggest biggest examples, most common examples of unhelpful coping responses, overthinking. To me, there are 4 different types of overthinking that I want to cover very briefly. So one of them is overthinking about the future. That'll be worry. What's going to happen? What might go wrong? How will I deal with this if it happens? One type is overthinking about the past. Why did that happen to me? What could I have done differently? What does it mean? How can I feel better about it? There's also self-criticism. So beating ourselves up, for instance, for feeling sad or stressed or low or tired. I hear it all the time. I'm weak. I'm not who I used to be. I can't cope. People put the boot in on themselves when they feel like they're not living up to their own high expectations. And then the fourth one, which is like this idea of stress about stress or worry about worry, is what we call sometimes self-monitoring. So that's this idea that we're thinking about our thinking or about how we're feeling. So imagine a client of mine, I was working with one this week, who, whenever she's talking to someone, half her attention is on how they're perceiving it. Am I coming across okay? Pardon, Bibiana?
The last thing you say is self, they understand
monitoring, like being excessively self-aware, you could say. And so she's worried about, will they understand me? Will I say something silly? Will I remember what they've said? And what that does is it means that she's not really present in the conversation. And it's actually more likely she'll miss something they said or what have you. So we got overthinking about the future, overthinking about the past, self-criticism, and self-monitoring. I want to ask people, are there any examples they can think of times when they were overthinking recently, let's say the past few weeks? And what were the consequences of that? How did that make them feel? How did that impact on their psychological well-being? Has anyone got anything for us? I know we covered some of this with people's answers to that initial question about what causes them stress. What are some of the things that you might find yourself overthinking about? And what I would say is that I think we all overthink to a degree, or certainly 99% of us. Has anyone got any examples?
I've got a medical example.
Yeah, go ahead, Bonnie.
One of my a consultant mentioned there could be another drug that I could move on to. And he just said it as an aside, and I don't think he realized that I was going to spend 3 months overthinking it. I analyzed it, I researched it, I read about it, I worried about it, I lost sleep about it. I decided that if my platelets were between here and here, I made formulas, everything. And then I just turned myself into a complete exhausted, frenzied wreck. And I had to actually say, okay, on this day, I'm going to stop thinking about it. I made a formula of what platelet count would equal what. And then when I then have a blood test, like 2 weeks later, it was better than expected. So I'd realised I'd spent basically 3 months freaking out over a possible change of medication that never needed to happen anyway. So I can see it in hindsight that it's exhausting. It takes all your cognitive resources and your physical resources, but I do go down a rabbit hole quite quickly. And that was kind of an example of just a consultant saying, well, then maybe you could do this drug. And I don't think he really even meant in this year or maybe in the near future. I think he just threw it out there and probably didn't expect me to go topsy-turvy with it.
Perfect example. And those things you mentioned, losing sleep, feeling mentally and physically exhausted in that frenzy, just completely wound up. Definitely relatable consequences. Bibiana, so you've got your hand up.
Yeah, I think that maybe I didn't quite get the questions. But if I got the question, I think that going to all this overthinking that I'm doing is basically completely hindered what I want to do. So I
Yes.
keep thinking, oh, tomorrow I'm gonna do this, and that. And then I wake up in the morning and something sidetracked me. Maybe I'm a bit too tired and I want to stay in bed until 10 or 11 because I feel tired. And then I get up and like, okay, so the day is wasted. It's no point in doing this. And then it's like the house as well, or as I was saying before, the people calling, or whether it's a family, because they are all abroad and I'm living here by myself. So sometimes I think that I shouldn't really. When you said something that really made me think that the overthinking is what's worse for me at the moment, because I went through the phase where was when I was in hospital. When I left the hospital, I couldn't sleep at night thinking about what was going on, the medications, thinking about what medication should I say yes, should I say not to that medication. Now I'm taking some medications that I'm not happy with, but I kind of made peace with it also because looks like finally the drugs are working and I'm getting good numbers. But then, you go on this Facebook groups, find that somebody all of a sudden they developed lupus, they developed another autoimmune disease, and all of a sudden they were fine for some times, and then all of a sudden they had to take IV again or rituximab, or they don't know what to do. And that I think that maybe I need to detach myself from the groups for a while, because essentially I look exactly as I used to look before getting sick in a way. And right now I feel well as I used to feel before, just the pain from the medications that I used to take, penicillin, as I was saying. But apart from that, in my head, I feel like I'm going to go in remission soon. And I like to think that I'm going to be in remission. I don't have to take any more medications. But I don't know if that is the truth or not. I don't know. And that is as well the thought that I'm wasting time overthinking all this stuff and not doing what I want to do. Or maybe I'm giving myself too many goals and I'm setting myself for failure.
There's a lot of wisdom in that, Bibiana. A lot of wisdom. And one thing I would pick out is what you said about how overthinking can stop us doing what we want to do. And you said before, the whole point of this therapy is for people to live, or the idea this therapy has about the meaning of life is to live a meaningful life and do the things we care about and enjoy. And if overthinking's getting in the way of that, then yeah, something that we can put some of our attention onto. And multiple people have said Facebook, Google, tremendously fertile fuel for promoting overthinking for sure, as well as some good info too, but can be a real challenge. Sue, I see you've got your hand up.
Yes, I was just on the subject of overthinking. Simple things like a holiday. I start to get quite panicky. This has been going on since I got diagnosed around about 2011, 12, so quite a few years ago now. At the very beginning, I think I was a bit blasé about it, and I didn't really research too deeply about it. and I carried on maybe blindly because my platelets never went below probably 40 or 50. And thankfully never had any bleeding or anything like that. But now they have gone lower below the 20, and I am on avatrombopag, which only started in February. But just simple things like a holiday. I start to think, oh, should I be going on a plane? Oh, how long's the flight? Oh, it's 4 hours. They say that, you're at more risk if you go on a longer haul flight. Also, that means I can't go to America or anywhere else because the flight would be too long. Then I start to look up the hospitals in the area where the hotel is, and it just becomes relentless. One thing leads to another. What
Yes.
happens if? What happens if when I get on the plane and I don't feel well? Where are they going to land me? Oh dear, I'm in the middle. And your brain just gallops ahead of you with every single thing that you do. You always need to be in a plan. I don't know whether it's a safety mechanism or quite what it is, that all you want to do is, no, none of my friends, if I go away with, my girlfriends, they turn around, they don't plan where the nearest hospital is and, what they're going to do if. So it's something that's become very unique to me, and listening to everybody's conversations, very unique to perhaps people with ITP.
Yeah, and thank you for that, Sue. Again, you hit on some really key points there, I think. And my answer to your wondering about, wonder why it is we do that. I think the issue was brought up at the start of the conversation about uncertainty. There's nothing more stressful for humans than uncertainty, and worrying is in some sense about trying to remove uncertainty. So it makes sense from that perspective. I think the thing you hit on that really spoke to me was how overthinking can spiral. It's a bit like the more we do it, the faster it gets, and the faster it gets. And it kind of, sometimes you call something a vicious cycle, but it doesn't really capture the fact that it's not going round and round. It's kind of going down and down. It escalates and accelerates often. Okay. So
can I just add something with
yes,
regards
please
to
do.
over planning? I feel exactly what was said, that about planning holidays, and I found myself not thinking about it and not planning because and then I found myself trapped in a Greek hospital, away from my family for over a month, and they wouldn't let me go, even though I'm a chronic case. Nothing works for me. Rituximab, I've taken all the medications so far, and they just wanted to heal me and make me better before they send me home. And so I had a very negative experience about that because I felt like a prisoner. And so now I'm overthinking where I'm going, if there's hospitals, because the only thing that works on me is IVIG, and planning my holidays around that. So I'm overthinking it. But sometimes if you don't, you might have a very negative experience that is actually more detrimental than if you didn't,
Yeah.
So
you've hit on something important there, I think, which is a good general observation about psychology, is that thinking about the future is not a bad thing. We need to think about the future. What I think characterizes overthinking to me is when we feel like we can't stop, when we feel like it's excessive, that maybe it's having a negative effect on us now. So you're exactly right. It's a gray area. It's a thin line between planning for the future and overthinking and worrying. It's a thin line between learning about the past, learning from the past, and ruminating. It's a thin line between giving ourselves a kick up the bum when we need it and being excessively self-critical. And again, the things that characterize that for most of my clients is that feeling of control. Is it out of control? Is it causing us a ton of stress? But yes, not always easy to tell the difference by any means.
Yeah, okay.
Andrew, in the
Add
chat,
something to
Johnson
that.
has put a comment on.
Sorry.
He says he finds having a plan helps, and
Yeah.
reaching out for professional guidance when needed also helps. So
Yeah.
basically, underlining what you just said, really. So yeah.
Yeah. Do you know, I remember a conversation I had with one of my clients once, and you know, we're having such a good conversation. Forgive me, guys, if we don't get through all the material today, but I feel like this is important. I had a conversation with one of my clients once who was a chronic overthinker and worrier. So she would worry for 6 hours a day easily. And one of the things she'd been worrying about was her son had just learned to drive, and she was worried he would get in an accident. And she spent 6 hours a night worrying about that. And we were talking about this topic of what's the difference between planning and worrying. And we did an experiment. And I said to her, right, I'm going to time you. I want you to come up with a plan for what you would do if your son got in a car accident. And I started my time. I said, go. Guess how long it took her to come up with a plan? I'm going to answer that because we're in a big group. It was probably about less than a minute. She said, I'd text my husband, I'd get my car keys, I'd go to where he is, or I'd call an ambulance if that was appropriate. We stopped the timer. We said, okay, a minute to come up with a plan, 6 hours every day to worry. The difference is a plan is finite. You know when it stops. You know when you're done. You put it in the drawer. You get it out when you need it. Worrying is not about planning. It's about managing anxiety. It's about that feeling we have in our minds and our bodies that feel so uncomfortable that the way we respond to it is, I'm just going to think a lot about it because maybe that'll take the sting out of it. But as I say, it's a complicated thing. And if anyone tells you this clear cut, I don't think it is. Sorry, Rhonda, I think I spoke over you there. Are you going to say something?
Oh no, that's fine. I want to say that one of the most profound things that ever happened to me was when I went into a friend's house and he had a credit card sized little card standing up on the shelf, and I read it, and it said, I have spent a lot of time worrying about what never happened. And whenever I start worrying, I think about that, and I think, you know, it is just silly to worry about something that you really can't do anything about, and something in the future that you don't know whether it's going to happen or not. So if you think about that, you know, even some people might like to write it down or their own version of it and have it there to look at and to think, well, yeah, what am I worrying about? And, you know, why am I worrying about it? Because you can spend an awful lot of time, if you look back, about how you've worried about something, and it never works out the way you think it's going to work out anyway. And I think it was really helpful to me to see that.
That's actually a quote from Mark Twain.
Is it?
Yes.
Oh,
Yeah.
there we are. All right. Thank you, Mark Twain.
I'm glad we've got Mervyn here to class up the sessions with the literary references. I wouldn't have got that, so thank you, Mervyn. And I think that as multiple people have said, when we're engaged in this overthinking process, this spiraling, it is exhausting. Your brain uses more energy than any other part of your body. You could be sat stock still and completely burn yourself out physically by overthinking. Not to mention mentally, not to mention emotionally, not to mention spiritually. It is like there's a pit in the bottom of our garden and we're trying to fill it in with dirt, but it's a bottomless pit. There's no end to it, potentially. However, let's talk about this next bit. So, what is the alternative or an alternative to overthinking? And I want to present to you being present. And this was covered before when people were talking about some of the helpful ways of responding. We heard about socializing, we heard about nature, we heard about doing things that you enjoy, even for a few minutes. And one of the things, when I say being present, what I mean is we're focused on something in the moment. Now, that could be a classic version of this is what's going on around us in terms of our senses. So enjoying the sound of the birds or the taste of a cup of tea or what have you, a song we're listening to, whatever. But it could also mean doing a hobby or having a conversation. It could mean reading a book or cooking a meal or watching TV or anything. But it means our focus, instead of being on our problems in our minds, is on something in front of us. I want to ask people, I know we've heard some of this already, so maybe this would be a bit of a shorter chat, but are there any examples people could give us of times recently where they felt present, they felt engaged in something in front of them, they were absorbed, they were occupied mentally. And what were the consequences of that? How did that affect their experience, their well-being? I'll just take a couple because I don't want to miss out too much of the final stuff. Has anyone got anything?
Well, I sew. I do sewing, and I find that's helpful.
Perfect. Perfect. Things we're using our hands, it's creative, we're making something, it's a project, it's a brilliant way to absorb our minds. Any other ones people have got?
Playing guitar.
Brilliant. How does it make you feel, Bonnie, when you're playing the guitar?
It means there's no room in my brain for worrying. So because it's just focused on the music, focused on a dexterity of my fingers, and it just fills up my cognitive space, which is amazing. There's no room for much more.
Perfect. And I think what you've said echoes what Rhonda said before. I think she used the word like respite. One of the things with the human body or the animal body in general is that it's designed to clear out stress. The same way when we have alcohol, our organs clear out the alcohol from our blood. It clears stress out from our blood too, but we've got to let it do that. And if we're overthinking, we're constantly topping up our stress levels by focusing on a threat. Anytime, even if it is 5 minutes or 10 minutes, we're focused on something else, our bodies will work like mad to bring us down a bit, break that spiral so it doesn't keep accelerating. Sue, you've got your hand up.
Yeah, I was just going to say work keeps me focused. When I'm working, these thoughts don't come into my head. I had a couple of weeks ago, I unfortunately got shingles. Being off work, suddenly the overthinking becomes 24/7 or every waking moment. But when I'm working and I'm focused on something, it pushes it to the back of my mind.
Yeah. They say, don't the idle hands do the devil's work?
Yes,
There's something like
definitely.
that with minds too, right? There's a reason why the most common time people say to me that they overthink is when they're lying in bed trying to get to sleep because there's nothing else for us to do. So yes, totally resonate with everything people are saying. I think I say here that being present is like two birds with one stone. And what I mean by that is that I always start off the therapy conversations with the stuff about overthinking. We want less overthinking. But to be honest, I'm misrepresenting what acceptance and commitment therapy is all about by doing that, because it's not about what we want less of in our lives as much as it's about what we want more of. And what we want more of is being present, because when we're present, not only are we not overthinking, we're not adding stress on top of the difficult challenges life has given us. But crucially, we're also getting more out of life. We're getting more meaning, purpose, enjoyment, engagement out of the things that matter to us too. So if it's a 2 for 1, you can't be playing the guitar and be immersed in that and be thinking about your problems. And likewise, you can't be thinking about your problems and really listening to that conversation with your loved one. It's one or the other. And if we choose to be present, then we're also choosing inadvertently not to be overthinking. Now,
Andrew,
go ahead.
yeah, my wife wanted to say something. Yeah.
Please do, yeah.
Yeah. It's just that when I'm sort of stressed too much, lot to do and can't figure out how the life is, going round, I normally go and help out in my daughter, because I got my daughter with special needs. So I go in her day center and day unit and sort of spend time with all the other clients. And I find immense happiness because you forget your own problems for a while. And really calms me down.
Perfect example. Yeah, and it's what we're talking about in the second session. When we can connect with things that matter to us, things that make our hearts sing, it's even more powerful than the kind of mundane stuff. There's real power and you've highlighted there, I think, a really important fact about human psychology is that we are on some level social beings, and caring for others is such a powerful thing. Jamie, we'll take one more on this and then we'll go to the next bit.
Hi there, thank you. Yeah, I've been listening to everybody and I think it sounds like I've been through some of the same cycles that everybody else has been through. When I was first diagnosed, I did lots of research, sort of over stressed myself, over worried myself. And then a few years ago, again, things like sport and those sorts of things would help. But then when your platelets are low, you've got to be careful about the types of sports that you're doing. Swimming is obviously a good one there. But I also found around 2021, I signed up for an app called Waking Up, and it's a sort of a meditation app. And I've been doing that regularly ever since. And it doesn't always work. Sometimes my mind sort of manages to sort of churn through things. Like if I've been to a consultation and the doctor has sort of mentioned different forms of medication and those sorts of things and potential things that will need to happen. But a lot of the time I've found it very, very helpful for almost switching off sometimes those unhelpful thoughts when you're overthinking. Yes, as you mentioned, when you're making a plan or you're doing something that's productive that would be useful, then that thinking time is useful. But when you're churning and you're revisiting the same websites and you're looking for things that might help, or your mind's just churning through things, it's just not helpful. And as you say, it's exhausting. And being able to switch that off, I've found really, really helpful. Just connecting with your senses. It can be going out for a walk, but actually those skills that meditation give you are really, really useful, I've found.
Jamie, have you seen my slides?
I haven't, but I've recognized some of the things here.
Did you know that this was the final slide was coming up? Something you said there, Jamie, beyond, all of your points are very well made and well taken. And something you said I want to pick up on, which is that you're exactly right, that nothing works all the time. This is why I start anything like this. Number one rule of psychology, life's very, very hard. We've got to give ourselves a break, right? You could be the most mindful, focused, whatever person in the world. Life is going to have stress around the corner for you that you're going to struggle to manage. That's what life is like. And so that's why we need to have reasonable expectations of ourselves, because we're allowed to have a bad day or a bad week or even longer than that, right? And if we try and we hold ourselves to a standard that says we're not, all that's going to happen, like Saul mentioned before, is that we're going to set ourselves up for failure, and then the backlash of that's going to be even harder. So yeah, it's okay to have a skill or an approach that works 9 times out of 10 or 8 times or 7 times. It's still a useful thing for our toolbox. And it brings us on to the final bit today, right? This is something I do with all my clients and my colleagues, most of them the same, and it's mindfulness. Now, mindfulness is something many of you will have heard of, many of you will have practiced. It's a very broad church nowadays, mindfulness. It can mean all sorts of things to different people. It can mean relaxation, spiritual connection. It can mean a kind of lifestyle or feel-good sort of exercise. So I want to be clear that the reason I do mindfulness with all my clients is quite simple. It's because it's a way to effectively practice the ability to choose to be in the present. So I've linked an exercise here, and essentially what it is that you close your eyes, you notice your breathing, how it feels going in and out of your body, and then what will happen is you will inevitably get distracted by a thought. Maybe it's a thought about a problem, maybe it's just a noise in your environment, or thought about, you forgot to get the chicken out to defrost or whatever it is. And the way we respond to that during mindfulness is to refocus on our breath and let that thought pass. And every time we practice that, and that might happen 50 times in 5 minutes, we're developing this muscle, this skill of the ability to choose to be present rather than thinking about our problems. To give you an example of how meditation practice can generalize, it's not just about the time we spend with our eyes closed with the incense on, right? If someone's able to notice when they've been distracted by a thought and refocus during mindfulness, they can use it in their everyday life. Like, for instance, imagine you are watching TV. Your eyes are pointed at the TV, you're staring at the screen, but you're not paying attention to what's happening. you're thinking about this appointment you've got coming up, or maybe one you've just had. You're off in your imagination, worrying or ruminating. And so not only are we stressing ourselves out, as some people have said, probably unnecessarily, but also we're not enjoying the TV program. We're not, it's not as funny, it's not as moving, it's not as exciting as it could have been. When we practice mindfulness, we can develop the skill to notice when that's happening and choose to refocus on the TV program, what's in front of us, what's in the present. So I'm going to ask you, anyone who's interested, and I would say give this a go and just see how it works for you, to try and do between 2 and 5 minutes of mindfulness practice a day. Because and I would suggest do this between now and next time we meet and we can talk about it. And the reason I say 2 to 5 minutes a day is that's all it takes to start to develop this skill. It's a bit like if I was asking you to practice a language or juggling or something. It's not about spending 1 hour doing it once a week or anything like that. It's little and often to develop this really psychological skill. I've linked an exercise here, the YouTube one. I'm going to ask Mervyn to send the slides around after this. You can click on that or copy it into your browser. If you don't use, you don't fancy that exercise or you can't access this link, there's apps, there's YouTube channels, apps for your phone like Headspace or Smiling Mind, or I'm going to send a script round as well via Mervyn, which is just me writing out a few steps to practice this. The final thing then that I wanted to say, I think 3 minutes left, so we've timed this pretty well, is that a lot of the things that I say about psychology and other psychologists too are simple. It does not make them easy, right? This is a tremendous challenge to get better at being present, to overthink less. It will be difficult for a lot of people. There will be times when they can't do it. But the rewards of developing this skill are commensurately large. It's a big payoff. So even if someone gets 10%, 15% better at being present rather than overthinking, the difference in terms of their energy levels, in terms of their well-being, in terms of them doing the things in their life they care about can really, really pay off. So, yeah, 2 minutes left. It would take one question. Has anyone got anything pressing? Maybe something I've said that didn't make sense or you think would be good for me to explain before I let you go? No? All crystal clear. Well, I'm glad to hear. So that's it then, Mervyn, except for me to say thank you everyone for listening and for your fantastic contributions. It's stuff like that that makes this hopefully useful rather than just me rattling off some slides. So thank you everyone, and thank you everyone who listened to. As I said at the start, that's just as valuable a contribution.
Thank you very much, Andrew, and thanks for everyone for actually joining us tonight. I thought that was an excellent session. Lots of good contributions from people involved.